Good afternoon, everybody. Thank you so much for joining us. I'm Jim Skogsbergh, President and CEO of Advocate Aurora Health. We really appreciate you being with us today for our 8th virtual town hall meeting, and we're grateful to have two of our outstanding clinical leaders with us to discuss the latest on all things COVID-19 vaccine. It's appropriate to do so as the number of deaths related to COVID-19 just passed the 500,000 mark in the United States earlier this week. But it's encouraging to know that more people have been vaccinated today than have actually tested positive for COVID. And the trend around number of cases, hospitalizations, and deaths is a good one, all going down. But we know that you have a lot of questions about the vaccine, efficacy, safety, supply, distribution, as well as what to expect in the coming days and weeks and what that means for you and your loved ones. We're going to try to address as many of your questions as we can today. We'll also hear from the governors of both Wisconsin and Illinois today as well. But first, I want to introduce the clinical leaders who are here to help us get your questions answered. With us today, we have Dr. Rob Citronberg, Advocate Aurora Health's Executive Medical Director of Infectious Disease and Prevention. Dr. Citronberg has been our go-to expert on all things COVID-19, and he is no stranger to those of you that have tuned in for past Facebook Live sessions. But a new face is Dr. Jackie Ivy-Brown, and we are so pleased to have her with us. She is a primary care physician based in South Chicago. And as you can imagine, she's already fielded plenty of questions from her patients about COVID-19. I want to thank you both for being here with us today to talk about the vaccine, a top agenda item for us here at Advocate Aurora Health and, frankly, for the entire nation, if not the world. Before we dig in, we'd like you both to take just another minute to introduce yourselves more fully, if you don't mind. Dr. Citronberg, how about you, for those that haven't been on previous Facebook Live?
Thanks, Jim. So I've been in the private practice of infectious disease for over 25 years. I've been fortunate over the last year to have assumed the role of Executive Medical Director of Infectious Disease and Prevention for Advocate Aurora Health. Came at a pretty good time. Before that, I went to college at the University of Pennsylvania. I attended medical school at the University of Connecticut, and I did my internal medicine and infectious disease training at Rush University Medical Center.
Excellent. Thanks, Rob. We're so pleased to have you here. Dr. Ivy-Brown, great to have you with us as well. Tell us a little bit more about your background.
Sure. So I'm an internist. My practice focused more so on the ambulatory setting. I completed training back in 2008. I attended medical school at Loyola Stretch School of Medicine. I did my residency training at Evanston Northwestern, and I've been fortunate to be here with Advocate Aurora Health since 2012, and I'm board certified in the field of internal medicine.
Great. Thank you both so much. And so here's what you as an audience has told us about these forums, that it's almost impossible to keep up when things are constantly evolving. CDC guidance, variant strains, vaccine developments, and so on. You love these sessions because we are putting medical experts in your living room, answering the questions that you have about all things related to the pandemic. Advocate Aurora Health is proud to be a trusted source of truth for you and your family. To that end, you can find all the latest Advocate Aurora COVID-19 vaccine information on our website at aah.org/vaccine. Again, that's aah.org/vaccine. Okay, a few quick housekeeping details. First, please submit your questions and comments, as we'll try to answer as many of them as we can in the time we have available. Second, should we run into technical difficulties, and we do not plan to, we'll make this video available on our Advocate Aurora Health Facebook page for later viewing. And yes, we will have closed captioning available when we push this out. Also want to mention that while all three of us are fully vaccinated, we came into this session wearing masks, and we are maintaining an appropriate social distance. Not sure what the camera does to the distance thing, but we are socially distant. And I bring that up, and I know you folks will make this point as well, because it's important that we all continue to mask, socially distance, and wash our hands. I know you're going to hear more about that in our session. It looks like a lot of questions have been submitted about vaccine supply, and rightly so, as there's more demand than we have available. I had the opportunity to talk yesterday with Governor Evers of Wisconsin, who shared his perspective on these challenges. Let's hear what he had to say. The issue of supply is of great concern for all of us, right? For the listening audience, certainly today, and those of us that are providing vaccine, when our cupboards run bare, that's kind of a concern. Tell me, what are you being told about supply? Are you getting daily updates? Are you getting weekly updates?
I had a chance actually to speak to President Biden last week. He was in Milwaukee, and I had a chance to be with him for probably about 45 minutes. That's in addition to grandkids, we also talked a lot about supply of vaccine. And basically what they're committed to is working with Pfizer and Moderna and hopefully soon another provider to their production, to ramp up their production. At the end of the day, and you know this, I know the people that work with you on the front line know this, is that we need lots more vaccine. It's not just incremental. And so that is the ultimate challenge. We can have the best and smoothest system in the world, but if indeed there is not a large increase in the amount of vaccine, this will drag on much longer than what we had hoped.
Yep.
See, the good news is that the administration is very transparent around these issues, and that gives us hope going forward that at least we will know what is expected for us.
So we'll be sharing more of that conversation toward the end of this program, but just be curious, Dr. Ivy-Brown, Dr. Citronberg, any reaction to what we heard Governor Evers express?
Sure. So I know from my patients, there's definitely an expression of frustration due to lack of vaccine supply. I have patients who are ready and willing to get vaccinated, but we can't offer them an appointment if we don't have that supply present for them.
Yeah, and I think, is it fair to say that their frustration sometimes is sort of directed towards us as healthcare providers, expecting us to have this stock of vaccine, which we really rely on the states for? I imagine there's a little bit of frustration that gets directed towards you as a practicing physician, certainly towards us as a provider, when in fact we're just waiting for the delivery of the vaccine, right? Rob, how about you?
You remember back in December when we first learned of the success of the vaccines, it was projected that it would take until about June of this year to be able to vaccinate everyone. I think we're right on target. In fact, we might even be a little bit ahead of target. People are frustrated because they're so eager to get the vaccine, which actually I love. I love the enthusiasm. We're just preaching patience. We anticipate in the next month the supply is going to get much better. Pfizer and Moderna have pledged to increase their output. We now have good news about a Johnson & Johnson vaccine, which we'll talk about a little bit later. We'll have supply of that as well, too. So we just want people to be patient. You will get your vaccine. We're moving through the line. Next couple of months should get a lot better.
Yep, that's good to know. And we'll probably hear that phrase of please be patient and please be diligent a few times before we're completed today. So let me kind of stay with you, Rob, if you don't mind. We know that the vaccines that have been authorized are safe and effective. We know that. And we know that they're our ticket out of this pandemic. So it's no surprise that some folks are frustrated when they can't, get an appointment even if they're over 65. You heard the governor talk about that. Other thoughts you might have about distribution. Do you have any sense of how quickly we might see it? Is it next week? Is it next month? Do you have any sense of how that's being distributed amongst the various providers? Just what are you hearing in your circles?
Well, right now it's there's a lot going on because we not only have our healthcare organizations providing vaccines, we have our retail pharmacies, and now we have mass vaccination clinics, which really can provide vaccine to many, many more people than we could even a month ago, but we just don't have the supply right now. So once we get an adequate supply of vaccine, we should be able to plug those vaccines into all these clinics and really be able to ramp up the pace of vaccination.
So this comment about ramping up vaccination leads to another question I have here on the iPad. And if you don't mind, Dr. Ivy-Brown, Jackie, I'll ask you first. And this is very difficult to answer, so sort of your best thinking or your best opinion. When can we expect to get back to normal? I mean, how many times have we heard that question, right? Concerts, sporting events, visiting with grandma. Will it be Memorial Day, 4th of July, Labor Day, Christmas? What's your best guess?
It's really hard to say. I'm hopeful that maybe by this fall, we will start to see some more normalcy, but that's going to look different depending on where you are. Normal time in Chicagoland may be different than in rural Wisconsin, but the driver for it is going to be the same. It's going to be based off of individuals being vaccinated, but yet still maintaining those safe practices of masking and washing your hands.
Yep, absolutely. What's your best guess, Dr. Citronberg?
It's going to be gradual. So it's not going to be one day everything's back to normal. It's going to be gradual. And we may be able to see this start very soon with outdoor events, particularly in people who are vaccinated. We'll start to see some activities return to normal. I think the last things that will return to normal, as we know it, are those indoor events that are congested, like concerts, indoor sporting events where they're really packed venues. Those will be the last to come back. But through this summer and fall, I think we'll start to really be able to do a lot of the things that we weren't able to do the past year.
What is the most optimistic number that you've seen regarding herd immunity in the U.S.? Are we thinking fall we might achieve it? Are we thinking early next year? I know the dates kind of move around. I get that, and I think the audience understands that as well. But latest that you've read or heard about herd immunity?
We don't exactly know what percentage of population we really need to get herd immunity. We're basing that off of experience with other viruses, other viral infections. I think maybe in that 75 to 80% range. Now, there's a possibility there are already certain pockets of communities in our country that have already achieved herd immunity. But for the general population, we're not there yet. But with successful vaccination, if we can get everybody who wants a vaccine vaccinated by the end of June or into July, we should be looking at the potential to achieve herd immunity by this fall.
Great, thank you. Same thought?
Same thought, and I'd just like to add to that, Jim, that really if you are an individual and you're wondering and debating on whether you want to get vaccinated or not, achieving herd immunity emphasizes that it's not just about the individual, it's about the community. And so if you want your community to be back to normal, you as the individual need to step up.
Yeah, it's a great message. By taking care of ourselves, we then take care of the community. Let's talk about communities. Particularly this question has to do with communities of color. We already know that the pandemic hit our communities of color harder. And now whether it's because of access, hesitancy, or a combination, it seems to be a real problem that we're trying to address. Dr. Ivy-Brown, start with you. Tell us what is behind the disparity and how we're engaging the various communities.
Well, first, thank you for asking that question because it's an issue. And if we don't have that dialogue about it, then we really don't come up with solutions to solve it.
Right.
It's multiple factors that really play into like why there's such a big health disparity. There's not a one size fits all. I think the first way that I'll tackle that is just kind of addressing the elephant in the room in terms of mistrust in the medical community. The Tuskegee experiment is not something that happened hundreds of years ago. That was within many of our patients' lifetime. And that knowledge of it, that psychological trauma runs deep. And that has been passed on to subsequent generations, and understandably so. The other thing that really is pervasive in terms of medical mistrust is in the U.S., we do live in a racist society. We are dealing with that. And the medical community isn't insulated from that. There's multiple studies, multiple cases that discuss specifically about medical bias and how that may relate to delay in diagnosis and delay in treatment. So it's a really uphill battle to climb to really gain the trust of Black and brown communities. The other aspect of what may be contributing to the health disparity is access. Many Black and brown communities are essential workers. And so gaining access to a vaccine during normal business hours is just not feasible for everybody. There's also the concerns that are present with transportation, with access to technology, as well as language barriers. All of these different pieces add up to creating this huge healthcare divide that we really need to purposefully look at and tackle to make sure that we are reaching out to those communities in a meaningful way.
So if I can, let's just press that point a little bit, because it is sort of the elephant in the room, and I'm so glad we can talk about it. In your office, when you are one-on-one with your patients, how are you trying to encourage them to say, hey, I've been vaccinated, I want you to be vaccinated? Is there any particular message that seems to carry the day, or does it vary with the individual?
Really, it varies with the individual. And I think the way that I tackle it with my patients is I ask them, I do say, I've gotten vaccinated. Tell me if you're not ready to be vaccinated, why? Mm-hmm. And then I just listen. Because sometimes I think I may have a notion as to what they're thinking, and it may be something completely different. And so I go to where the patient is instead of trying to bring them to where I am.
Yeah, yeah. So one more, and then Dr. Citronberg, if you would comment as well. In terms of reluctance, is it is it just a race? Is it age? Is it geography? How would you describe the reluctance that both of you get from your patient populations? If you get reluctance, does it break down by geography, race, age? How does that?
Well, I think certainly the issues that Jackie just discussed very eloquently are central to this discussion, no doubt. One of the things that I hear from a lot of people and have heard all along is they're skeptical about the vaccines because they were perceived to have come out too soon. They came out within a few months, and well, they can't possibly be safe because they only came out in a few months. They haven't been adequately tested. Well, we know now that there are a lot of reasons that enable those vaccines to come out so quickly. And also, when we talk about vaccines as being safe, it doesn't mean they're free of side effects. When we talk about safe, we're comparing the risk or the side effects to other vaccines and also to the known long-term effects of COVID. And there's really no scenario in which the natural infection with COVID is better than getting a vaccine, even acknowledging there's some risk. So I think that's the area. It's still to this day, even though the vaccines have now been out for a few months, we're still hearing a lot of people who are skeptical about how fast they came out and how could they possibly be safe. We don't know the long-term side effects of the vaccines, which I guess is true, but we do know the long-term effects of COVID, which right now is over 500,000 deaths in this country.
Right. Right. Yeah, thank you. And I've heard you express that before, Rob, and that's very, very powerful. So back to vaccine now. I'm reading, paraphrasing. I received my first shot. Okay, I'm scheduled for my second, but I know about the supply problems. Should I be concerned if I don't get my second shot scheduled, as was originally intended?
Yeah, obviously we want you to get your second shot as close to schedule as possible. Even if it's up to 6 weeks after your first shot, there's still going to be fine. The most important thing to understand, there's no evidence at all that delaying the second vaccine hinders your immune response. You'll still respond just as well. You just get a better degree of protection when you get that second shot. So we certainly want people to get it. We're concerned, as our patients are concerned. We pledge to get you the vaccine as soon as we have it, but we don't want people to panic. You're not going to be harmed by a delay in the vaccine, but we want you to get it as soon as possible just to maximize your immune response.
And that's the important response, I think, to the question. You're not going to be harmed. We do want you to get it, and when you get that call, step up and get that second shot. Jackie, if I could just pivot to you a little bit. Are you getting questions in your office about, hey, I don't want the Pfizer, it came out too soon, I want to wait for Moderna, or I don't want the 2-shot one, I want the 1-shot one? Because I think our consuming public is fairly sophisticated and reading a lot. Now, there's a lot out there to be read, not all of which is factual, but are you getting discerning questions about which one I should get, and how do you respond to those, Rob, yourself? How do you respond to those questions like, hey, is one better than the other?
So yes, I am getting those questions, and I would say a lot of individuals have been stating, I think I'll just wait for the 1-shot. But what I've really been encouraging patients, I'm like, COVID isn't waiting for the 1-shot. So as soon as you have the ability to get vaccinated, please get vaccinated.
Agree completely. My advice, you take the first vaccine that becomes available to you right now. From what we know about the 2 mRNA vaccines, the Pfizer and Moderna, as well as what we just learned, even some more information today about the Johnson & Johnson, they're all going to work really well.
Yeah. And maybe you've already answered this, but it's here, so I want to honor the person that wrote it in. Because it's stored differently, should we look at it differently? In other words, one's a deep freeze, one's just a refrigerator. Is that an issue at all for you as practicing physicians? Or are you saying makes no difference, get whatever vaccine is available?
Get whatever's available.
Yeah.
The storage issues are related to how the vaccines are manufactured. The mRNA vaccines require colder storage, but just I would get anyone that's available.
Yeah, so question now about variants. We've read a lot about it, and obviously it's created some anxiety. So here's the question. What about all the variants that we hear about on the news? The UK variant, the South African variant, and now we're hearing about a variant in California. Should we be worried about these? Are they more dangerous? Do the vaccines work against them? Rob, maybe you first.
Well, viruses always mutate. They always have. I think now just the microscope is on virology, where people weren't really paying attention to it up until this past year. Viruses always mutate. So there are variant strains that are circulating. What we know is the UK strain, that B117 strain, is spreading a lot in this country. The good news is that it is susceptible to the vaccine. The bad news is it seems to be more contagious than the original strain. But no matter what, most of the variants that we have right now are still susceptible to vaccine. All of the variants can be prevented by the physical barriers, by masking and social distancing. So they're obviously of concern, particularly about surges down the line, but they're manageable at this point.
Yeah. It would appear that you all are well ahead of me in terms of these questions, because the next one is exactly what you had just mentioned. But Jackie, I'll turn to you. After we're fully vaccinated, okay? After we're fully vaccinated, here's the question. Is it okay to do whatever we want? Can we just tear off our masks and begin hugging everyone? How do you advise your patients in the office?
So I empathize in that, like, yes, I too would love to just take my mask off and be close to family and friends and not have my invisible 6-foot ruler with me everywhere I go. But the reality is, even after you're fully vaccinated, we still have to be vigilant for a lot of the reasons that Dr. Citronberg just mentioned. So that does mean we do need to continue to mask. We do need to wash our hands, because there is a chance that we could still spread viral particles even though we ourselves are not sick. However, if you are in a situation where you are fully vaccinated and your loved one is fully vaccinated, then you can engage and be a little bit closer together than previous. So that is the good news.
Yeah. Rob, anything you'd add to that?
Completely agree. We'll get there. I thought about it recently. I haven't shaken anybody's hand in about a year, and you miss that, right?
I know.
You miss all that
it's
contact.
Strange. It is strange, no doubt about it. Question for you both. And I imagine that many of your patients are parents, so they might be asking about their children. And the question has to do with, now that we're hearing several pharma companies, they've either started or planning for clinical trials to begin on children, what do you think parents should know about that? Do we know enough to educate?
It's interesting because the companies who are manufacturing the vaccines are starting to enroll children in trials, and hopefully have some information by this fall. But now that we have sharply declining rates of COVID in our communities, it's actually going to take longer to prove an effect of the vaccine. Back last fall, it was easy to recruit patients because a lot of them were going to get COVID during that time. Now we have lower rates. It's just going to take longer. But ultimately, I think we'll get there where we can first start to vaccinate high schoolers, and maybe by next year, even elementary school kids.
Yep. Questions you're getting about kids at all, Jackie?
I am, because everybody wants to know, when do they feel like it's safe for their children to interact with other children, to go to school? But just as Dr. Citronberg said, the studies and the trials are starting, and so.
Yeah. And this next question sort of leads to that. Since the vaccine is not yet approved for children, is it safe to send them, specifically pre-K through 8, back to school, even if teachers and staff have been vaccinated? So our kids have not been vaccinated, teachers have been. Can we send them back to school?
Yeah, kids need to go to school. The science actually is really clear on this. This has been studied very well, that in schools that are able to maintain safe practices, social distancing, masking, school is among the safer places that you can go in the community. And historically, the rates of transmission of the virus in school are considerably lower than in the surrounding general community. So it's important that the schools are able to provide all the safe measures, the social distancing, the masking, staggering the option for hybrid learning, so not all the kids are there at the same time. Yeah, it's safe, and kids can go to school.
So back to efficacy and safety. Because we know more and more every day about the vaccine results, is there any new data about the vaccine resulting in complication or death? Any new knowledge about risks or possible side effects?
From my perspective, no. In fact, the numbers actually are even getting better. The rate of severe allergic reactions is actually even lower than we thought. Initially, we thought it was about 11 per million. Now it's about 4 per million. It's very low. There are a lot of local reactions that you've heard about, and some more serious side effects, but on balance, these are very safe vaccines.
Yeah. A lot of these questions are very similar, but again, I want to honor the folks that wrote in. So the question is this, and I think you've addressed it, both of you. Do we know yet if getting the vaccine prevents transmission of the virus? If yes, Why will it still be necessary to wear masks? If no, why is the vaccine being so highly recommended?
Well, so to answer that question, as we mentioned earlier, there is still the chance that we could pass viral particles even though we ourselves are not sick. So why get the vaccine? It's in part to help prevent severe COVID. It's in part to help prevent passing it onto a vulnerable person who potentially could pass away from COVID. It's to help us get to that herd immunity status.
Yeah, yep.
Yeah, and we've also gotten, we don't know yet, we don't know the answer to that definitively yet, but even in the last couple of weeks, we've gotten some very good data from Israel and from the UK looking at vaccinated populations, and the vaccines do appear to prevent transmission in those populations, but we just don't know definitively yet, so we can't make any recommendations yet to give up on the masking or distancing.
Right, so
but,
be safe.
Yeah, but over time, I think so, but right now, still got to do what we're doing.
Next writer said, I've had COVID. Should I get the vaccine? How long do I wait after my infection to get my shot?
Usually 90 days is what we recommend based off of CDC guidelines.
So 90 days. But should I even bother to get it? I've had COVID already.
So it is still recommended, even after you've had COVID and it's past that 90 day, to still get vaccinated, yes.
Got it. Thank you. And I'm not sure we know the answer to this yet, but it says, or the question is, how long will the vaccine protect? Do we know that yet?
Not yet, but it looks, when the vaccines first came out, we weren't sure if this was going to just be a one-time vaccine or if it was going to require boosters. Now it's pretty clear with the spread of the variants that there are going to be boosters that are needed. Whether they're annual boosters, we're not sure yet, but there will be certainly more than one vaccine that's needed. So this might just be part of like you go for your flu shot and your COVID shot every year. It's a possibility.
Mm-hmm. After receiving the vaccine, is it okay to be around individuals who have also been vaccinated without a mask? You spoke to this a couple minutes ago. What about those who have not been vaccinated? So I'm vaccinated, you're vaccinated. Do we have to wear masks? I'm vaccinated, you're not vaccinated. Do we have to wear masks? Do you speak to that?
So in the scenario where both individuals are vaccinated, you can feel a little bit more comfortable in engaging in usual social activities. For vaccinated and not vaccinated, again, we emphasize the strong need to wear masks, social distance, because you do not want to potentially pass viral particles to an unvaccinated individual.
Yep. Anything to add to that, Dr. Citronberg?
Perfectly said.
So I experienced some, and it says excessive, so I experienced an excessive side effect from the first dose. Should I still get my second?
That's a great question, and it really depends on what the nature of the side effect was. The most important thing is to determine if you've had an allergic reaction. An allergic reaction is a very specific symptom. It could be hives, it could be throat swelling, it could be anaphylaxis, the more severe reaction, it could be wheezing. Those are allergic reactions, and we do not recommend getting the second dose if you've had an immediate allergic reaction, which is one that occurs in the first 4 hours. But if you've had other side effects that aren't allergic reactions, you can get the second dose of the vaccine. But if there are any questions, we just ask that you ask your physician for confirmation. But the vast majority of people should be able to get the second dose of the vaccine.
Can I ask you both, and I'm sure the audience would be interested in this, particularly those that have not been vaccinated yet. Did you have any reaction to your second shot? Or you both had second shots, right? So any reaction personally?
So I did get some muscle achiness and I felt a little bit tired. Lasted for roughly around 48 hours. After that, I felt back to normal.
Yep. Anything?
I didn't, but that's probably because I'm old. So it turns out the reactions to the second vaccine are more prominent in younger people. And even those people, they're self-limited. They go away in a day or two. And I like it because it's telling us that your immune system is responding beautifully to the vaccine.
Okay, so this leads to the next question. If I got my second shot, I didn't have a reaction, does it mean that it's less effective?
Not at all.
Okay. Don't worry about it. Get that second shot, whether you have a reaction or don't have a reaction, we know it's working, right?
Yes.
Okay.
And Jim, may I add on, for individuals who may have allergies to food or even to medications, the CDC states that you can still get vaccinated. So if you have any questions about that, the patient should definitely reach out to their physicians.
Great point, great point. Don't let that be a barrier to getting the vaccination. Check with your doc. Yeah, that makes sense. Okay, next question. Is it true you shouldn't take pain relievers or antihistamines before getting the vaccine? How soon before getting it is too soon? How soon before getting it is too soon to take? What about taking after? So, should I take something beforehand? Should I wait and take something after? Should I not take anything at all? What are you advising patients?
It's just a controversial topic, and I think it's probably truthfully gotten blown out of proportion. There were some very preliminary studies that showed when people who've gotten other viral infections or got COVID, if they were taking something like ibuprofen, that they didn't develop as many antibodies. But there's no evidence, first, that you still can't produce a good immune response, and it's never even been studied with a vaccine. So in general, we don't recommend pre-medication just because we don't want you to mask the symptoms of a potential allergic reaction. But if you've got symptoms afterwards, like fevers or chills, you can take ibuprofen or you can take Tylenol as long as your doctor approves after the vaccine. But what's also really important to note, if you're on a chronic medication like prednisone, we do not want you to stop your medication before your vaccine. So it's really important, and if there's any questions, make sure you talk to your doctor before that. But you don't need to stop your medicine. If you take ibuprofen every single day and you need it every single day, you don't need to stop it before your vaccine. And like everything else, just check with your physician before the vaccine.
Right, right. So, Dr. Ivy-Brown, let me ask you this. I would imagine in your patient population, you must have some patients that have autoimmune disease. So this question, and I'll ask you both, but how do you know the vaccine is safe for people with autoimmune diseases?
Well, actually, we're still learning about that. Right now, we do know that patients who have any kind of immunodeficiency of any type, they are at risk for developing COVID. But in terms of the studies with vaccine trials, that particular patient population wasn't looked at as closely. I don't know if Dr. Citronberg has more to add.
Yeah, that's exactly right. And so it's, there's some concern that people with autoimmune disease could have a reaction to the vaccine. But the bigger picture is many people with autoimmune disease are on immunosuppressive medications to treat their autoimmune disease. And they are at high risk, as Jackie pointed out, of developing severe complications from COVID. So right now, most of the major medical societies still strongly advocate for getting the vaccine for people with autoimmune diseases.
Right. The advantages outweigh the disadvantages,
right,
although there are some. So the next series of questions has to do with women. What should women of childbearing age consider? Is it safe for pregnant women? And what about breastfeeding women? If you would, please.
So at least for women who are childbearing age, there's no contraindication or reason why they should avoid getting vaccinated. The mRNA vaccines do not interfere with one's DNA. That's where our genetic code is held. So there should be no hesitancy on that. What we do know, at least in terms of pregnant women, is that pregnant women have a higher chance of having severe COVID or complications as a consequence of it. However, in terms of safety and efficacy, from what we've seen, there's no reason why mRNA vaccine should harm mom or harm baby, but we still do not know definitively. So it is going to be a personal choice that I would really encourage patients to talk about with their physician.
Got it. Same answer for breastfeeding women?
Breastfeeding women, again, there doesn't appear to be anything that we need to be concerned about in terms of the vaccine harming a breastfed baby.
Anything to add, Dr.
Yeah,
Skogsbergh?
I agree. Like the American College of Obstetrics and Gynecology strongly supports vaccination, especially for those pregnant women who have a high occupational risk. For example, someone who's an intensive care unit nurse where they might be exposed to COVID. Those people should get vaccinated after discussions with their doctor.
Yeah, so this is a follow-on. Will the vaccine affect fertility or placenta formation? Again, questions about the long-term effect, I think.
There should be no effect at all on fertility nor with placenta formation.
Okay, no effect, very good. Some women get enlarged lymph nodes in the armpit after the COVID vaccine. Can you share what women should do if they are due for their mammogram?
So there is a side effect of enlarged lymph nodes after getting the COVID vaccine. That's where our body's immune system, one of the places that it lies. When that happens, if somebody were to get a mammogram, it can look like they may have breast cancer. So what the recommendation currently is that if you have had the COVID vaccination, try to wait 4 weeks after getting that second dose before getting a mammogram. Or get your mammogram done before you start the first dose for the COVID vaccine. However, I do significantly want to emphasize that if you are a woman and you feel like something is wrong, you feel a lump, you have pain, forget everything else. You just talk to your physician, you get a mammogram.
Yeah, yeah. Thank you very much. Good question. Now, is it true that you should wait to get vaccinated if you're receiving chemotherapy or radiation? So we're kind of talking about various chronic conditions or various conditions that patients are faced with. How are you advising patient populations that might be in chemotherapy or getting radiation?
Well, it's a double-edged sword. The concern with people who are immunosuppressed, maybe getting chemotherapy, it's not so much a safety issue. We're not concerned that the vaccine is going to cause harm. The concern is that it might not generate enough of an immune response, and we just don't know. And as Jackie pointed out, these patients weren't studied in the vaccine trials. So people who are immunosuppressed are at very high risk of having severe complications from COVID. So we still recommend getting the vaccine even during your chemotherapy or radiation therapy.
Okay. Next question. I've had an allergic reaction to the flu shot. Okay, so this is someone who got the flu shot, severe reaction. Can I or should I take the COVID vaccine, even with my allergic reaction to flu?
Oh, yes, you should. So if you've had an allergic reaction, a severe allergic reaction to another type of vaccine, you can get the COVID vaccine, but instead of observing you for 15 minutes after your appointment, we'll observe you for 30 minutes after your appointment in case of any allergic symptoms. But yes, the answer is you certainly can. As long as you've not had an allergic reaction to a prior COVID vaccine or to one of the known ingredients of the COVID vaccine.
Anything to add, Jackie?
No, I agree.
Okay.
Yeah.
All right. Next question. Is there a way to check one's antibodies to see if someone's vaccine was effective?
The answer to this question, it's evolving. So the traditional antibody test that's been around now for many months does not detect antibodies to vaccine production, particularly. The type of antibody tests that were used in the trials are very different from the commercially available ones. Within the last couple of weeks, there are now some tests that have become available on the market that they're anti-spike protein antibodies, and they actually can detect response to the vaccine. The problem with that is we don't have an answer. Let's say somebody gets the vaccine and their antibody test is negative afterwards. We don't have an answer yet about what to do. We can't advise getting additional vaccines. So I don't strongly encourage people getting that test right now. We know the vaccines from the trials are extremely efficacious, very high rate of response. And if you don't have an answer to the test, then you shouldn't do the test. I think down the line we'll have a better answer about what to do with people who have a negative test after their vaccine, but right now we don't have that.
This is a question that I think we all can, I'll even step in and opine on this one. It seems like too many seniors still aren't getting invitations to get the vaccine. Why? And then what is Advocate Aurora's current plan and process? So we've chatted about this before, a couple of problems. Number one, supply, right? So our cupboards are bare as we speak. So when that next dose of vaccine arrives, we're going to put it in arms as soon as we possibly can. That's one of the reasons. I think at Advocate Aurora Health, I believe we have vaccinated about 10% of our over 65 population thus far. So lots more work to be done. So you're right. A lot of too many seniors aren't getting invitations. The reason why is availability of vaccine. And then our current plan. We're actually, and you both were very important in terms of establishing this, but we have decided that we're going to vaccinate over 65 with chronic conditions. So again, this question, if you're a relatively healthy 65-year-old, you're not going to get put to the top of the list. And then Rob, I know that you were involved in a recent decision that actually broke age down 85 and older. Do you want to speak to that for a moment?
Yeah, we know that the mortality rate goes up significantly over the age of 75 and actually particularly over the age of 85. And people over the age of 85 have extraordinarily high risk of death from COVID-19 infection. So we are factoring that into the equation about who gets invited. We're looking a little bit more closely, not only over 65, but how far over 65. For example, 75 is worse than 65, 85 is worse than 75. So we're definitely factoring that in. But I think as you brought up, there are so many patients in our population who are over 65. it's just not physically possible to get everyone vaccinated right now with the available supply.
Right. So age, older, sort of front of the line, chronic conditions, front of the line, and then we use a geography test as well for disadvantaged communities. And then a question later on, I'm gonna pull it up, and if you don't mind, Jackie, I'll ask you, what is meant by disproportionately impacted? Because there's a lot of data and research out there about how this hit the Black and brown population. Do you mind speaking to that?
Sure. So when we say disproportionately impacted, it's looking at the occurrence of COVID-19 in a certain group. And so as you were mentioning about geography, the geographies that have been hit hardest by COVID-19 have been Black and brown communities. And so just going back to, I guess, earlier in our conversation where we talk about health disparities, we'll question why is it so disproportionately impacted in these communities where there are lots of health disparities present for multiple reasons. And so we need to address that.
Yep. I know that we're running up against some time constraints, so let me get to as many of these as we can. Can I get on a wait list to receive the vaccine if other people cancel their appointments? And I think you're both familiar with our no dose left behind policy. Do you want to articulate that?
Yeah. Right now we are doing everything possible to not waste a single dose of vaccine, but at this time we don't have a wait list in place. We watch the news and there may be some other organizations or places where they do that. Right now we're not offering a wait list for vaccine appointments.
And I'll blitz through these just because of time. How did the recent weather impact vaccine distribution? Obviously, as we've stated before, it created havoc with the supply chain. It's been disrupted, which is why we've sort of run out. And we, all of it, at least I'm sitting in Chicago today, and I love this 40-degree weather. So hopefully that supply chain is going to start flowing again. And as was mentioned earlier, if J&J gets approved, and we expect it to be, then we'll have a third vaccine available, and that's going to help a lot with the supply, we hope. Let's see. How will you determine who is eligible for vaccination under Phase 1C and contact patients for an appointment to receive the vaccine?
We're still working through the prioritization schedule. We're trying to get through 1B right now, but again, by the time we get to 1C, we're going to have a lot more vaccine available. So I think the issues are going to be less restrictive as we roll out to the next phases of vaccine. Again, our goal is really to have everyone in this country who wants a vaccine to be able to get one by the end of June.
So here's a question about my proof of vaccination. Should I carry it with me? Do I need to provide proof of vaccination? Do either of you have your proof of vaccination with you today?
I will say I do not have it on my person, but I do have it in a safe space.
Mm-hmm. And
yeah, I don't have it, and to be clear, the card that comes with when you get your vaccine, it's more of a record of vaccination rather than proof, because I would hate to say this, but I could probably print one up on my computer if I wanted to. But I'll tell you that's really important is that in the next few months, you will see electronic proof of vaccination. They'll interface with the state's registry system where you can get an electronic proof, whether it's a QR code or something that will be on your phone. And when you go to book a trip, an airline ticket, a cruise, go to a sporting event, you may actually be asked to provide your proof of vaccination.
Yeah.
Those developments are probably a few months away, but I think things will change once we get true proof of vaccination. But that record of vaccination is very important. I've got it in a safe place as well.
Yep. Will Advocate Aurora use Johnson & Johnson vaccine? The answer is yes. We'll use whatever vaccine is given to us, and without hesitation, put that vaccine in people's arms. Let's see. What are you going to do to help people who are suffering from long-term effects of COVID, referred to as long haulers, those with chronic post-COVID syndrome? Thoughts about that in the medical community?
So I know in my practice, I'm already seeing these patients. They're suffering from chronic heart, chronic lung disease, PTSD, depression, chronic fatigue. The best that I can say is that we're still looking at, we're studying it, and every scenario has a different treatment or plan of care that needs to be enacted. So just know that I would say to patients that if you're experiencing this, you're not alone. It is becoming more of a known entity, and reach out to your physician to seek help.
Yeah, and I'd like to add that one of the things that I hear that I hate to hear, because I hear it over and over again, if there's a 99.5% chance I won't die from COVID, why bother with a vaccine? Let me just have the COVID. To Jackie's point, there's evidence now that up to 1/3 of people who get COVID have these long-term symptoms that follow. So it's not simply a matter of living or dying. Many people are living with COVID, and it's disabling in many of these people too. So yet another reason to get the vaccine. It's not just about life or death, it's about living with COVID after you've had it.
Dr. Citronberg, this question is directed at you. I think folks were listening earlier. Can Dr. Citronberg expand upon why we all know now why it's okay that the vaccine has come out so quickly? So maybe go back over that.
Sure.
and why people shouldn't be concerned that it got pushed out the door too fast.
Sure, and that's a great question. There's a few reasons. One important one is that the mRNA vaccines are easier to make than the traditional vaccines. The technology is such that, first of all, they were already in evolution for many years before COVID, and it's relatively easy to make mRNA vaccines compared to other vaccines. The other thing that was important is that these vaccines were already funded, they were already paid for, and a lot of the delays in development of vaccine is because you don't have money for it. You have to raise the money. These vaccines were already funded in a large part, certainly the Moderna vaccine, by the government. And the third is that they took a risk. They mass-produced the vaccines before the results of the trials were known. So there was risk there. If the vaccines didn't work, they would have had to throw out all the vaccines that were made. But when they learned that the vaccines were effective, they already had a supply of vaccine ready to go. In any other situation, that might have taken 2 years to ramp up the production of the vaccine. So those are the principal reasons why these vaccines were able to come out so quickly.
Right. Another question, perhaps for myself, but maybe you're dealing with this as well in your offices. If you don't have a smartphone, how do you get an appointment? How will you know how to use your code? So I think we're talking about an invitation, and now someone is unable or doesn't have access to some of the technology. What are you advising your patients?
So I'm telling them, do not be discouraged, because we are reaching out not just through email, but we're reaching out through phone, text, mail. There are multiple ways that we are making sure that we're reaching out to our vulnerable populations.
Yeah, and that speaks to another question here. Once the supply is adequate, how will I get an appointment? And once again, I don't know if it's going to be on the clip with Governor Evers, but he was talking about his own circumstance up in Wisconsin. He said, I got a notice from my provider that said, be patient, don't call us, we'll call you. And he said, in fact, they did call me when my time came. So same response, I think, to this question is, once the supply is adequate, we will be reaching out to our patients and offering them an opportunity to schedule a vaccine. So once again, patients, kind of sit tight. How soon after I get vaccinated can I travel? There's a question. Are you advising your patients, Jackie, to, hey, it's time, you go ahead and get on a plane, get on that cruise ship, or are you telling them to wait a little while?
So I am advising patients to at least wait 2 weeks after their second dose, because that's when the consensus is that efficacy is there.
Yeah, I agree, and I think that it would be very soon. I myself made 3 airline reservations this week for travel in the future. I can't wait to go places. But even when we travel, we still have to be very careful. We have to wear our masks. We have to socially distance. And then when you get to your destination, you still have to be safe when you go there too. So it won't be long before we can start to travel, much like we did before.
We're going to take one more question here because we are running out of time. And I think we've answered it, but because of these questions come up so often, I think they bear repeating, the responses. How do you decide who gets which brand of vaccine? And I think the answer is we don't really decide. The state sends us the vaccine, and we provide the vaccine that's given to us, correct? Or is there any other?
We want people to get whatever vaccine is available. We are confident that all of them will work. They'll all work well. They'll all work about the same. You take whatever vaccine you can get.
Yeah, and I think the helpful thing about conversations like this is it sort of debunks some myths, is that we don't necessarily order it. We simply receive it, and we're waiting. We don't really know what we're going to get. We don't really know how much we're going to get. I think all that's getting a little bit better, but it is the state that provides the vaccine to us. We then administer it to our patients. We are out of time, unfortunately, and I want to thank all of you for your great questions, and certainly want to thank Dr. Citronberg and Dr. Ivy-Brown for the very valuable discussion today. You guys have been outstanding. Before we wrap, a few quick reminders. You can find all the latest Advocate Aurora COVID-19 vaccination information again at aah.org/vaccine. That page will continue to be updated with the latest information, so you can take some comfort in that. I also recommend you download our Live Well app, where you can get all your health information in one convenient place, and follow our social media channels for more health news. One more ask. We are going to do another Facebook Live session like this one, and your feedback is really important to make sure that we're getting to your issues. So we want to hear from you. Please take 2 minutes to fill out the survey at the end of this. For everyone watching, more vaccines are on the way. In the meantime, we ask for your patience and your vigilance. Please continue to wear a mask, social distance, and wash your hands. Until next time, stay safe. And before we go, I'm going to toss this to our Wisconsin and Illinois governors. We are grateful to hear their insights on the vaccine distribution and where we go from here. Thanks for watching, everybody. Here come the governors. Governor Evers, I also know for a fact that most of our public doesn't understand the distribution process. They don't know why, this clinic has 2,000 doses and this health system has 10,000 doses and so on. Do you want to talk a little bit about how the state decides where the vaccinations go? Is there a logarithm? I mean, just briefly for our consuming and listening public, how are those decisions being made?
Well, first of all, we have a relatively robust data system that we know, like the percentages of people who have been vaccinated in each county and parts of each county, and it's our obligation as a state to make sure that it's not all going to Northeast Wisconsin. We need to make sure it gets to Southwest Wisconsin. We also have obligations around the people that have struggled with this disease, and that's mainly Black and Brown and Indigenous people. And we also have an obligation as a state to provide, do aggressive outreach to those folks, because in very many ways they have some skepticism around vaccines, period. So all those things are moving parts as it relates to that. But in addition, Jim, another way we do it, and this may sound simple, but the requests from the various organizations plays a huge role in this.
When that supply is relatively stable, you said it's pretty stable, maybe going up a little bit. We want it to go up a lot, of course. But when you take 10 doses and you used to give it to 2 providers, everybody both got 5. Well, now you have 10 doses and you're giving it to 10 different providers, because right, as you pointed out, you're trying to get distribution in all corners of the state. That naturally depletes or reduces the amount of supply that's available for instance, Advocate Aurora Health. I know that's very frustrating for those of us that want to give the vaccine, and frustrating for our patients that are waiting to get phone calls, et cetera, et cetera. So a good chance to educate our public about that as well.
Yeah, the very hope, frankly, Jim, is that the next vaccine that's approved on an emergency basis, that could help speed it up dramatically, and that is really important.
Governor Evers, you've been kind to give us time for this Facebook Live event. Any final thoughts for our viewers today?
Well, certainly, we also have to make sure that we understand, everybody, and I know the folks that do the good work for you understand this, is that as a state, we also have to continue to mitigate the disease. We're saving lives by vaccinating people. We also save lives by wearing a mask, being physically distant, and washing our hands. All the things that we know. That has to happen and continue to happen. And it's always a push-pull in this state. I get that, but it's really important to wear a mask. The other thing, though, to kind of conclude this conversation, is that Advocate Aurora and the other healthcare providers in the state of Wisconsin, the people that are doing the good work in our ICUs and in our clinics are doing a great job. This pandemic has taken 500,000 lives in this country, and well over 6,000 in our state. it has been mind-numbing in a great way. And then of course, so we have these frontline workers that are trying to keep people alive, working real hard. And then we have these other heroes that work for the healthcare organizations, and they're saving lives by putting shots in people's arms. But we have to keep it up. We have to keep up the good work, and your folks at Advocate Aurora are really critical to making sure that we end this and get back to some semblance of normal in the very near future.
Well, thank you, Governor, for those nice compliments. Let me turn the tables and thank you for your leadership. This is probably not anything you anticipated when you stepped into office. No one could have, but we are grateful for your leadership in the state of Wisconsin and wish you well.
Thank you.
Thanks for being with us today.
Thank you. Great partnership.
Thank you. Bye-bye now.
Bye.
Hello, everyone. This is Governor J.B. Pritzker. Here in Illinois, we're hitting major milestones with our COVID vaccination plan, with more than 2.25 million doses administered to date. We continue to vaccinate Phase 1A frontline healthcare workers. So if you qualify for 1A but have yet to get your vaccine, please consider doing that now. I want you to remain healthy, and frankly, we all need you to. We're also vaccinating those who are eligible for Phase 1B, including those age 65 and older and frontline workers. Starting tomorrow, we're expanding 1B to include those who have high-risk underlying conditions such as diabetes, cancer, or heart disease. This isn't just an issue of equity. It's also the right thing to do for those who have medical conditions that make them especially vulnerable. With more than 12.5 million residents in Illinois, we still have a long way to go to get everyone vaccinated. But more than 14% of our population has already received at least their first dose. That makes us number one among the top 10 most populous states. Overall, our progress is something everyone in Illinois should be proud of. I expect the federal government to increase vaccine supply to states in the coming weeks. And as we work together to end this pandemic, we must continue to be patient and remain vigilant about wearing masks and maintaining social distancing. I'd like to thank the 40,000 Advocate Aurora Health doctors, nurses, and staff in Illinois who've been on the front lines of our COVID-19 response. This has been a challenging time for us all, but it's your commitment and self-sacrifice that's helped save so many during this pandemic. To all our healthcare heroes, thank you for your long hours at the hospital, especially to those who clean the medical facilities or serve food to patients. You provide an essential function for our COVID patients and really all patients. However it is that you contributed, Advocate, it's your tireless efforts that help us bend the curve and see the light at the end of the tunnel. On behalf of a grateful state of Illinois, thank you for everything that you do to support our families and to protect our communities.